Ekta, you can start whenever you wish, as people tend to join in later.
Okay. So
And then it gets posted immediately onto our YouTube channel, and people start viewing it there. They'll see it over and over. So your message will be heard.
okay, great. So then I will get started. Hello, everybody. My name is Ekta Votra, and I am going to be talking about burn prevention and first aid. Just to give you a little introduction, so I actually didn't start out as a nurse. I started out in pharmaceutical sales, but then quickly realized nursing was my passion, and just by seeing other nurses and working with them. And I went back to nursing school, received my BSN in nursing, and most recently completed my master's in advanced clinical management and nursing leadership. I've been a nurse since 2011. I started out in medical oncology, working with bone marrow transplant, leukemia, lymphoma patients, and then transitioned into wound and ostomy care, and most recently in burn outreach. So kind of had a very eclectic path in nursing, but have enjoyed every moment of it. So as I mentioned before, today we're going to talk a little bit about burn prevention and first aid. So what is burning people? So when we take a look at this chart here, there's a lot of numbers and there's a lot of bar graphs here, but basically, this looks at by etiology, by gender. So when you're looking at scald burns, which seems to be the most common in terms of number of cases, females and males are getting burned equally by scald burns. And we'll talk more about what that is. But when you look at the next section, to flame burns, males are actually getting burned more. So when I talk about flame burns, I mean things like house fires and things of that nature. And then the third most common one, and again, males, it's more common, is contact burn. And that might be grabbing a hot pot handle or perhaps leaning up against a hot radiator by accident. So those seem to be the most common in terms of etiology by gender. So scald, flame, and contact. So who is getting burned? So when you look at this chart, again, what it shows us here is that basically it's middle-aged people who are getting burned the most. But one thing I think is really important to point out is that children and the elderly, while it's not happening the most frequently in that age range, those two groups of patients, that demographic, is the most vulnerable for a number of reasons. So this is just some interesting statistics to show how it's happening, who is it happening in. This is a chart that looks at percentage of total body surface area. And actually, the good news is that most of the size distribution, when patients are coming in, clinicians look at the percentage of area that a patient has been burned. It's about 1 to 9.9%. And that is good news, because that means that we can get a better handle on the burn and take care of the patient in the best way. Of course, we do that for patients that are burned, let's say 50, 60%, but what tends to happen is they are far more sick, their acuity is far higher, and it can certainly prove to be a very difficult hospital course. So we want the size of the burn to be as small as possible. In terms of location of where it's happening, this pie graph here looks at categories of place of occurrence. So you guessed it, home is where most burns are occurring. And then the next section is industrial. And then the third one is street or highway. Now, I'd like to point out that home, burns, injuries occurring in the home, I mean, this really rings true even more so now, given the COVID-19 pandemic. People are home more than ever, and they have been now for almost 2 years. So no surprise here that people are getting burned at home. So when we drill down to New York City, what causes New York City burns? So percentages of burns by cause here. So the number one reason is hot liquid. So this could mean hot liquid, hot tea, boiling water. And then the next one is fires. So once again, things like apartment fires or house fires. And then the third one is contact with hot objects. So as I mentioned before, maybe grabbing onto a hot pot handle or a hot oven door, things of that nature. I like to show this chart, and while this data is a little bit old, but I think it's worth showing. In 1970, there was a record high of deaths of New York City civilian fire deaths at 310. And in 2016, that number really dropped to 48 for a number of reasons. One, of course, the code certainly changed in buildings, policies, rules, regulation, and also more education. So fire departments doing more education, as well as folks like myself, burn outreach, really getting the message out there about how we can prevent these types of injuries from occurring. So while that is good improvement, we certainly still have our work cut out for us. So this is a great chart, and I think it kind of really paints the picture here. So this chart here looks at the approximate time it would take for a first-degree burn and a third-degree burn. So, and on the left side here in the column, you can see the temperature. So when you look at, let's say, 155 degrees, it would give somebody a first-degree burn instantly and a third-degree burn in 1 second. So the thing is that it just takes one moment. It's a split second where an injury can occur. I'd like to also point out that 100 degrees is safe for bathing. That is the temperature that the water in the bathtub or your shower should be. And in terms of what a water heater should be set at, it should be set at 120 degrees. And we'll definitely talk a little more about this as well. So the good news is even though we have all of these statistics, we have all of this data, and while we are making great strides, the good news is that it can very much be up to us. We can take specific steps to prevent these types of injuries from occurring. So I always tell people, whether I'm talking to young students in an elementary school or middle-aged folks, or if I'm talking to seniors at a senior center, we really have the power to change things, right? So let's start with some cooking tips. So first things first, in this day and age, we are so doing everything at once. We're multitasking, we're answering the phone, the oven is on, something's on the stove, somebody's calling my name, the Amazon delivery person is at the door. Everything is happening all at once. So it's okay to have a few reminders. So using a timer, for example, having a timer set when something is in the oven. Sometimes those timers are on the oven, but it might even be helpful to get one of the ones that actually rings. So setting reminders, whether that's in the phone or a timer. And the thing is when you're cooking, that's the only thing you should be really doing. There's really no need to multitask. It's important to stay focused on the task at hand. Do not cook when you are drowsy or intoxicated. And you might be laughing at this, but the thing is that it's very true. Some people, we've seen it all, they might come into the hospital and they had a few drinks and decided, you know what, I want to cook some macaroni. And wouldn't you know, that was probably a bad idea. So if you've had a couple glasses of wine or, maybe you've been drinking, probably best not to cook anything on the stove or in the oven. Also, if you're feeling drowsy. Now, there could be a number of reasons why one would feel drowsy. Perhaps we didn't get a good night's sleep. Maybe it's medications that we're taking. But if you are sensing that within yourself, probably best to stay away from the stove. The next one I hate doing, but it's an important piece of the puzzle, is cleaning that exhaust fan and the oven regularly. A lot of buildup can occur in the exhaust fan, a lot of grease. And then also in the oven, there could be crumbs and anything that might have fallen down while something was in the oven before. So it's important to make sure that it's getting cleaned appropriately. Another thing is to wear short, close-fitting sleeves. I can't tell you how many times we've had patients come into the hospital, they're cooking a great big meal. Let's say somebody's got a house dress on and reaches to the back burner. And now all of a sudden the sleeve is hanging down and the sleeve catches fire. And so really important just to wear tight, close-fitting sleeves so that you can prevent this from happening. The next tip is keeping a pan lid or dry pot holders or oven mitts near you. I know it sounds so simple, but especially if we're cooking a big meal and let's say we have a side dish, a main course, and another side dish, there's a lot of things that are happening in the kitchen. And very easy, it could be that we just forget that, oh, a pot handle is very hot right now. So keep it in plain sight so that it's a reminder to use the pot holder or pan lid. So turning pot and pan handles towards the back of the stove. This is a big one because I know sometimes if I'm cooking, I'm tossing the garlic and onions in the pan. But best thing really is to turn that handle towards the back so that you don't knock it over. Or let's say if you have a little one, whether it's a grandchild or a child, niece, nephew, you know, they're not trying to reach for that hot pot handle. Use microwave safe cookware that allows steam to escape. That's a really important one as well. Making sure that that steam doesn't build up. This next tip is always difficult too because we're hungry. We want things to be done quickly, right? So if we're microwave something, just allow the food to rest before removing it from the microwave. Especially, you know, it's glass oftentimes that we're using in the microwave, and it can be really hot. So I definitely grab things out of the microwave when it's way too hot, and of course I burn my fingers. So just taking a minute, letting it sit. If you're frying, use a lid or splash guard to prevent grease splatter. This is a big one because especially, let's say, you know, if I'm frying chicken cutlets or anything else for that matter, and the grease is really splashing up, that could go into my face, onto my chest. So best to use a guard or a lid. Never ever leave the kitchen when frying or grilling or cooking really any type of food. And this goes back to the multitasking thing, right? So it's common for us to pick up the phone to make sure, you know, we're answering the door and doing all these things at once. But the bottom line is it's just best not to leave the kitchen. And then again, remembering to use that timer as well when you're cooking. So a few things. If your oven catches fire, keep it closed and turn it off, right? So if it catches fire, don't try to open it, just keep it closed and turn it off. If a pan catches fire, turn the heat and cover it with a lid if you can safely do that. If not, then it's really important that you're never carrying anything outside or using water. Only use things like baking soda, salt, or really the best thing you could do is have a fire extinguisher. You should really always have a fire extinguisher nearby and a smoke alarm ready to go. Fire extinguishers should just definitely be in the kitchen, right? And the other thing about the smoke alarm too is making sure that the batteries are tested and checked on a monthly basis. You know, first of the month, check those batteries, make sure that they're working okay. And if they're not, then that might be a good time to get the building manager involved or have somebody help you change the batteries. The other thing is if the fire gets out of the control, just get out, call 911, get out, do not go back in, shut the doors and alert your neighbors. The truth of the matter is everything else can be replaced, but you cannot be replaced. So best if you feel like things are not headed in the right direction, just be safe and get out of the building. So we were talking a little bit about scald burns. So this is an important thing to discuss because, as I mentioned before, it's one of the most common things that we see. And how does a scald burn occur? So hot liquid, hot tea. I've had a lot of young children come into the burn center where we see these young children, they ran up to their mom and dad because they were so excited to see them, and mom was maybe holding a cup of tea that she just made. And wouldn't you know, it spilled on the mom, and then it spilled all over the child as well. It could be boiling water. We've also seen, if somebody has a really bad cold, they were doing, let's say, like a steam bath almost, where they put a towel over their head and put Vicks Vapor Rub in the tub of water, and they thought the steam would help clear up their sinuses. So we've seen all different kinds of scald burns, and that's why they are so common. But we can do things to actually prevent them from happening. So first things first, I would say, and I like to mention this because whether you have children or you have children visiting your home, they are often the ones that come in with these scald injuries. So keeping children away from the stove if they are over 3 feet away from the stove. And we can always make it like a fun game. Maybe create a no kid zone with some painter's tape on the floor and say, if you don't come in this area for the next hour, we can spend an extra 10 minutes at the park. Whatever it might be, whatever it is that you need to really prevent those children from coming near that stove. Another thing too is steam and microwave popcorn. That's something, I know I didn't always think about, but the bag, when it's done popping, can be hotter than 180 degrees. And that is hot. And we saw in the previous chart that 180 degrees, that can be an instant 3rd-degree burn. So it's important to follow the package directions. Allow it to really stand 1 minute before opening, and open the bag away from your face. But again, these are really simple tips and tricks that you can do around the house to prevent these injuries from occurring. So another great way to prevent scald burns is setting the water heater at 120 degrees or just below the medium setting. Really important here. And if for some reason you may not have control of that water heater setting, again, that's a great time to get the building manager involved or the super involved, because that is the appropriate setting. The picture on the right here is that basically this is a patient. It's a woman that got a scald burn and really just never thought that tap water could get that hot. And that is exactly what can occur. So it's really best to be bathing at temperature that's 100 degrees, and then also setting the water heater to 120 degrees. So some other tips in terms of preventing scalds is you want to take a bath. That's wonderful. Fill the tub. You can fill up the tub, but run your hand through the water to test for hot spots, right? So you want to make sure that there's not any really hot spots that are in the tub of water. The other thing I'd like to mention is that for people who have diabetes, oftentimes in their feet, they might lose sensation. So what can happen is they'll step in and they think the water is okay. Then they go down to sit in the tub and all of a sudden, oh my goodness, it is so hot. And then they can't get out. They are having trouble getting out, and now they have a scald burn. So best thing really to do is with your hand, or you can even use the elbow. Also, it can't hurt if you're helping a child bathe to get one of those thermometers that tests the water as to how high the temperature is. I know it seems like, kind of little silly things, but these are things that can really save somebody and prevent very serious burn injuries from occurring. So we live in New York City, and I love the city. It's wonderful. And I love the steam heat that we get from these great radiators, but they can be really hot, right? So they can be really hot. And that's why I encourage people to advocate for themselves to get these radiator covers. This can really save people's lives, because there are instances where, let's say there was a loose rug on the floor and Now somebody has tripped over that loose rug. And all of a sudden now their shoulder is pressed up against the radiator and they can't get up because they've fallen. So now not only are they injured from the fall, but now they have a burn injury as well. So a couple of things: don't keep loose rugs around the house, period, but especially not near a radiator. And if you don't have a cover, this is a great opportunity to advocate for one. This was a National Burn Awareness Week campaign that was done in 2019. And I kept these slides in here because I think they really talk about some important points. So the first thing is that older adults have thinner skin. So they are at greater risk for deeper burns at lower temperatures and shorter exposure times. So I'll say that again. Older adults, they have thinner skin. That just happens as we age. But they are at greater risk for a deeper burn at lower temperatures and shorter exposure times. So it's really important that our older adults are being extra cautious. Use a lot of caution when carrying hot liquids. Best thing to do is carry it in a thermos that has a lid. And that brings me down to point 3. Get a lid for your coffee or tea to prevent scald burns from happening. Always test the temperature of the bath water before entering. As I mentioned before, using your elbow, using a thermometer to test and make sure that it's at that 100 degrees recommended safe bathing temp. And please do never place hot liquids on low tables that a young child could reach, because we know young kids, they're curious, as they should be, but sometimes that curiosity can result in injury. But again, simple solution, placing them out of reach and away. So this was summer, we just passed. This is some summertime tips, but I think it's also worth mentioning. Fireworks, sparklers can get up to 2,000 degrees. That is an incredible temperature. So really to be mindful if that is something that we are partaking in for like 4th of July or whatever. But just to be really careful if that's something that we're doing. Just remember too that fireworks, they can cause damage to the eyes, hands, and face. And over 50% of the firework injuries, it happens in people under the age of 20. So important just to practice the most amount of safety possible. So really with the fireworks, best thing to do is leave it to the professionals. Follow local and state rules. I love the Macy's 4th of July fireworks. It's great just to watch them, or maybe even watch them on TV. Don't allow children to handle fireworks, as tempting as it is, because that can really quickly turn into an accident. If, of course, they're being used, then keep a bucket of water close by. A protective barrier, so observers should be just observing at a distance, and really consider alternative methods. So glow sticks, things of that nature, maybe just watching on television or getting an early seat to watch any other firework displays. So now summer is over, but we have winter coming up. So I wanted to talk a little bit about frostbite. So we know New York City also gets really cold, gets windy, and we know about those sub-zero temperatures. So it's really important just to discuss a little bit about frostbite and hypothermia. So once again, we can help prevent these things from happening. So if you're going outside and it's super cold, it's really important that you dress properly. So making sure you have a hat that's covering your head, making sure the ears are covered, a scarf, and now with everybody wearing masks as well, that certainly provides another layer of warmth. A coat, a water-resistant coat, mittens, gloves for those fingertips, and then just several loose layers of clothing. So making sure that you're layered up and it's loose fitting. and then water resistant boots. So when you're going outside in the winter, you just want to make sure that the most affected parts are covered. So your nose, your ears, the toes, cheeks, chin, fingers, all of that. So when we talk about frostbite in terms of signs and symptoms, what is it that we might be looking for? So any redness or pain in any of the skin area you might notice, that might be the first sign of frostbite. And then sometimes your skin can be a little whitish or grayish or yellowish. And then often it can also feel firm and have a waxy feeling. But numbness is one of the bigger signs, I would say, for frostbite. And the other thing to mention is hypothermia. And basically, this can happen at really cold temperatures, but it also can happen at cool temperatures. And this is when a patient's body temperature is dropping, right? If they become wet or chilled for some reason. And so what are signs and symptoms of that? So shivering, exhaustion, confusion, fumbling hands, slurred speech, drowsiness. And for young children, it could be that they have really low energy, really cold skin, and they could be really, really red as well. So just a few things to keep in mind for as the winter months do approach. So with frostbite, if a person's temperature is below 95 degrees, one thing is for sure, get medical attention immediately. And whether it's hypothermia or frostbite, of course, get to the hospital as soon as possible, especially as I mentioned before, if that temperature drops below 95 degrees. Get that person into a warm room or shelter, right? We want to start warming up the body. If someone has any wet clothing, let's try and remove that wet clothing and get them under some warm blankets and dry clothing as well. So let's just say the toes, for example, were affected by frostbite, right? They're turning different colors, there's numbness. You can actually place the areas that have been affected in warm to touch water. So just remember, it's warm to touch water, not boiling hot, but just warm to touch. We've talked a lot about the different burn injuries that can occur, the most common ones that can occur, but what do we do if, oh my goodness, I burned myself, now what? What's the next step? So let's talk a little bit about burn first aid. So first things first, if let's say you've been burned, remove any loose clothing or jewelry around the burn as soon as possible. But one thing that needs to be emphasized is that do not remove any clothing that is stuck to the burn. Because if you, let's say, for example, I was burned on my chest and I had a necklace on and I was able to get my necklace off, but my shirt seems to be stuck to that burn. Just leave it, because if you try to remove the shirt, it might actually pull up your tissue and your skin there. So just leave it if it's stuck. This is really important. And actually, I want to make a correction here. Cool the burn. This slide says 10 minutes, but it should read 20 minutes. So run under cool, not cold water for at least 20 minutes. So I want to emphasize that one more time. Cool the burn, run under cool water for at least 20 minutes. Okay. So what does that essentially do, right? Cooling the burn helps slow down the burning process. It can help stop infection. It can also help with some pain as well, but 20 minutes is a long time. I'm not going to lie to you, but this is the best thing that you can do, really. And it's been proven by cooling the burn with just cool water for 20 minutes, it really does make a difference. Don't use ice. I know even when, before I got into the burn world, I would think, oh, let me just get some ice. But actually that can cause further skin damage. So best not to use ice, and don't overcool. This is certainly for somebody that, let's say, has a bigger burn size. But if the victim starts to shiver, just stop the cooling process. You can take over-the-counter pain relievers as directed by your physician, such as Tylenol or ibuprofen. And of course, you want to make sure that you can actually take those medications. So the other thing is that goes along with burn first aid is leaving blisters intact. I know that's a tough one because especially if you see a blister there, it's spilling up with fluid, it's best really just to leave it intact, and you can wrap it in something loose, like a loose gauze. Once the blister has ruptured, then you can apply some antibiotic ointment like a bacitracin or something like that. But the best thing to do with a blister is just to leave it intact. Hopefully, it could reabsorb, it can act like a Band-Aid, or it'll just rupture on its own. Cover the burn with a sterile gauze bandage or a clean cloth, like something that isn't non-adhesive. And I say that because, let's say, for example, you burned your arm and now you've put something that adheres to that burn wound and you come into the ER, that dressing is going to have to get removed and it's going to be painful. So best to do it with something that is not adhesive. Wrap the burn area loosely and don't put too much pressure on the burn tissue because that will cause more pain. So not too much pressure. Drink lots of fluids, and then of course you can come see us. This is a good one. So no home remedies, please. And I, after doing these presentations for some time, I feel like I've heard all different types of interventions, and really it could be for a number of reasons, right? So maybe this is what we grew up with, or it could be cultural. But there is nothing better than just the cool water for 20 minutes, because oftentimes these interventions, they do more harm than good. So for example, toothpaste is a big one that I hear. So toothpaste, a lot of people have said, oh, I use it and it was okay. But the thing is with toothpaste, it could actually trap heat at the burn site and cause more pain. I've heard about egg whites, butter, oils, all different kinds, coconut oil, olive oil, tomato sauce, potatoes, all different types of home remedies. Best just to use the cool water 20 minutes because all these other things too, in addition to possibly causing more pain, they could also increase the risk of infection as well. Chemical burns, not as common, but I feel like this is something to just mention. Is the bottom line is we want to stop the burning process. And guess what? You guessed it. Copious amounts of water until pain-free are told to stop by the medical personnel. Just be careful here as well because regard the runoff as hazardous. And what I mean by that is, for example, let's say you were putting some lye down the drain and now for whatever reason, you got it on your leg and you are you're rinsing it with water as you're supposed to. But now whatever is coming down your leg, it's mixed with lye and water. So just make sure that it's not getting on your foot. So be really careful of that because now you don't want your foot to be injured. So if you can remember, take a picture of what chemical was involved, how did it occur, what was the duration of the contact, and was there any decontamination at the scene? Should I call 911? So just remember here, large burns, if it's bigger than the affected person's hand. And what I mean by that is if it's bigger than your hand, if it's just look at your hand, not my hand. If it's bigger than your hand, right, then call 911. Deep burns, second and third degree, 100%, you should get to the emergency room. Any eye, airway involvement, hands, feet, face, genitals, and over a joint. And especially, these areas, because you can have swelling that can occur. And let's say, for example, you get burned on your elbow. And if you don't seek the appropriate care, what can happen is that mobility can be lost if it's not taken care of properly. All chemical and electrical injuries, uncontrolled pain, of course, you want to seek attention for that. If you have a persistent fever, greater than 101.5, that's not relieved by medication, or perhaps there's redness that may be extending beyond the border of the burn that would indicate infection. This is all a great reason to get to the hospital. And then at the very least, you can always go to the burn clinic, and that's our number here. Or if you have a question, you can certainly reach out by calling this number. So this just talks a little bit about our process, about what happens in the hospital. If somebody comes into our emergency room, a burn consult is placed. They're seen by the burn nurse, resident, fellow, and it's really a collaborative decision on what the next steps need to be. Sometimes there's direct admissions from other institutions where people will be transferred from other institutions to ours. And then trauma activations, of course, we don't want to see these, but these are large burns, inhalation injuries. Maybe it was a big fire, and of course, something like 9/11. This just gives a little history about the William Randolph Hearst Burn Center at New York-Presbyterian. It was founded in 1976, and it was New York's first burn center, and we're the only verified burn center in the New York City area. And we're really proud of that because we meet a lot of rigorous standards through the American Burn Association and the American College of Surgeons. And we treat a wide variety of patients. The burn world is, it really takes a village. And, in our burn ICU, there's 20 beds, that's adult and pediatric. It's the only ICU I've ever seen that has this blended intensive care unit, and it's definitely a special place. This is a lot on this screen, but this just talks about all the different types of conditions that we treat and the types of burns that we treat. But as I was mentioning before, the burn specialty team, it really does take a village. So there's all sorts of people who are specialize and take deep interest in taking care of burn patients. So you have your burn nurses, child life specialists, burn surgeons, psychologists, skin bank specialists, outreach, what I do, quality, nutrition, so physical therapy, occupational therapy, just again, a whole host of people that are involved in making sure that our patients get the best care possible. So I thought these were some interesting facts because hospitalizations related to burn injury, it's about 40,000 per year average. So basically that's saying over 60% were admitted to 128 burn centers. But really what I want to focus on here is that the survival rate for burn admissions. So to all reporting burn center was about 97%. That's a really great number. So that says that, we are doing really good work, that people are surviving these burns. But of course, as you can imagine, it sometimes can be a long road, especially if a patient has a very large size burn. So while we're doing great work, as I mentioned before, we continue to make strides and we still have a lot of work to do. I always like to plug the Phoenix Society. It's a wonderful organization for burn survivors. There's also some online support available. There's a lot that burn survivors go through. There could be depression, guilt, loss of appearance or limb, people, their things, or home, employment. So it's a wonderful community where people band together and really support one another. And they just do phenomenal work. So I always like to give them a plug. So last thing I will say is, if you take away anything from this presentation, stop the burn, flush with cool water for 20 minutes. And that's the best immediate first aid that you can do. And of course, for any 911 burn injuries, just call 911 for any burn emergencies. And if you have a question, you can always reach out to the outpatient burn clinic as well. And the number is there. Thank you so much. Any questions?
Yes, actually, Ekta. Alfred, I believe, wanted to know about dry ice burns.
Okay. Yeah, so dry ice burns. I haven't seen a ton of dry ice burns, but I would say for that too, I think just the cool water. That is my understanding.
Okay. And I actually have a question about the settings on on water heaters.
Mhm.
And if that is a city code, especially if you are in any building. Do you know if
So
it's
my
if it's
Yeah, so I've gotten different answers to that question because I have asked that same question. And some folks have said, yes, it's a city code. And then some have said, oh, there's no way that, our water heater is set to this temperature. So I feel like I've gotten mixed answers about that question, but that is why I think this type of education is so important, because that might not be something someone is thinking of just right off the bat, but having this information, I think hopefully people will be more willing to reach out to their super building manager and say, hey, maybe this should be brought up at the next meeting, or making sure that it is set at that temperature.
Well, I agree. I am the president, or I was the president of our building, and we have some families here, and they really complained about the temperature for their children. So
Yes.
we lowered it quite a bit, but I just wondered if there was a standard, a city.
Yeah, I mean, and if there isn't, then there ought to be, because, and I just can't imagine that there isn't, because I'm sure that there are certain codes that buildings have to follow, but if they're being followed, we're not quite sure about that. Any other questions?
Hi, Ekta. I just decided to unmute myself. This is Carrie. How are you?
Hi, Carrie. Good, how are you?
Great, thank you. I really enjoyed your presentation. And I was curious about your role doing outreach. Can you tell us a little bit more about the types of groups to whom you provide burns education and outreach?
Yeah, I would love to. So, it's been an interesting journey, because I started this role right before the pandemic. So now everything has really transitioned to a virtual platform. But I conduct education with all age ranges. So it could be kids in elementary school, middle school, high school, to new moms or new parent groups, or it could be senior centers, talking to residents of senior centers. So it really is a wide range in terms of who I'm providing the education to, because the truth is that I think anyone can be an advocate when it comes to this, even the youngest of kids, like let's say in elementary school. So it's definitely a wide range, but yeah, I would say schools, senior centers, new parent groups. I've done a talk with nannies actually as well. So things like that.
Thank you.
Ekta, I would like to say that Carrie is assigned to the Burns Center as a clinical medical librarian. So if you ever need any information, she is actually assigned to the unit. So please use her.
Yes, yes. I actually know Carrie, and we've been working together for a while, and she's wonderful. Yes, yes. She's actually helped me out a few times as well.
Excellent. Okay, I would like to ask everyone to look in the chat box and see that Andy has posted a survey, and we really love for you to take it. And there may be another question or something in the chat box, but please bookmark that survey.
Okay.
Okay, it seems like that ended it. So Ekta, thank you so much for your time. We appreciate it. It was a wonderful, wonderful talk. And I think it really gave us a lot of good information. So
Thank you so much. I really appreciate you having me. And, you know, if I can ever do this again, I would love to do it.
okay, that's good to know. Okay. So
All right.
have a great day.
Thank you. Thank you, everyone.